When we care for individuals, families, and aggregates in the community, we are not working in isolation. The strategies and priorities of organizations such as the World Health Organization shape the health policies of the Philippines and many other countries. The Global Development Goals we will discuss today, namely the Millennium Development Goals or MDGs and the Sustainable Development Goals or SDGs, have provided us with roadmaps that have guided and continue to guide national and local health efforts, especially in addressing persistent inequities and achieving health for all. Why is this important for us as nurses? Because the health problems we encounter in our communities, like malnutrition, communicable diseases, maternal mortality, non communicable diseases, are linked to larger global goals and targets. Let us begin our journey by first understanding the World Health Organization, its mission, vision, and impact on global and national health. The World Health Organization, or WHO, is the principal authority on global health within the United Nations system. It was established in 1948, soon after the devastation of World War II, at a time when the global community recognized that health was central to peace, security, and human development. With headquarters in Geneva, Switzerland, WHO operates through six regional offices and works in more than 150 countries. Its role is to coordinate international public health efforts, provide leadership, set technical norms and standards, and support countries in achieving better health outcomes. WHO is grounded in the belief that health is a fundamental human right, a notion that shapes all of its programs and interventions. It is important to remember that WHO's work extends across the entire spectrum of health, not just combating infectious diseases, but also promoting mental health, addressing environmental health, reducing the impact of non communicable diseases, and preparing for public health emergencies. WHO's mission is quite ambitious and still very humanistic. That is, to help all people attain the highest possible level of health. The organization defines health as a state of complete physical, mental, and social well being, not merely the absence of disease or infirmity. This is a very progressive view of health, because it means that health encompasses not only biological and medical factors, but also psychosocial and environmental factors. An example in our Philippine context is how the Department of Health, supported by the WHO, is increasingly promoting mental health services in communities, recognizing that mental health is part of overall well being. WHO performs five key core functions globally. Leadership. It provides leadership on major global health matters such as pandemics and universal health coverage. Shaping the research agenda. It identifies research priorities and encourages dissemination of valuable knowledge. On setting norms and standards, the WHO developed schedules and guidelines. For example, they were responsible for developing the global immunization schedules and infection control guidelines. In articulating evidence based policy options, WHO helps countries design effective, scientifically sound health policies. One of their core function is to provide technical support. WHO offers countries capacity building, training, and policy guidance, very relevant to countries like the Philippines. WHO leads several important global initiatives. These include promoting universal health coverage, ensuring that all individuals can obtain the health services they need without suffering financial hardship. Coordinating preparedness and response for health emergencies. This was clearly shown during the COVID 19 pandemic, where WHO provided real time guidance to member countries like the Philippines. Promoting healthier populations through policies on nutrition, physical activity, and the reduction of harmful behaviors like tobacco and alcohol use. Addressing the burden of NCDs like hypertension, diabetes, cancer, and mental illnesses, and promoting environmental health. One of the most influential contributions of WHO was the Alma Ata Declaration of 1978, which introduced the concept of primary health care, or PHC. Primary health care advocates for 1. Universal access to essential health services. Two, community participation in health decision making. And three, intersectoral action, meaning health cannot be addressed by the health sector alone, but must involve other sectors like education, agriculture, and housing. In the Philippines, this was the philosophy behind the creation of barangay health stations or BHS and the training of barangay health workers or BHW who were bringing primary care closer to communities. WHO is committed to health equity, meaning it aims to reduce unjust differences in health outcomes between different population groups. For example, WHO works to ensure that women in rural areas of developing countries have the same access to skilled birth attendants as women in urban centers. In the Philippines, this equity principle underpins programs like the DOH Reach Every Purok or the REP program, which ensures that even geographically isolated barangays or places receive immunization services. WHO actively promotes health promotion, which goes beyond disease treatment and focuses on enhancing well being. Some major initiatives include the Global Strategy on Diet, Physical Activity, and Health, which combats obesity and diet related NCDs. The Tobacco Free Initiative, which supports countries in implementing the Framework Convention on Tobacco Control, an important tool since tobacco use remains a major cause of preventable deaths globally and in the country. Mental health action plans and promoting awareness through annual campaigns like World Health Day. WHO coordinates global responses to public health emergencies, such as pandemics, outbreaks, and disasters. During the COVID-19 pandemic, WHO provided critical leadership in data sharing, diagnostics, vaccine development, and equitable vaccine contribution through COVAX, a partnership that benefited many lower income countries, including the Philippines. The International Health Regulations, or IHR, is a legally binding framework through which countries agree to report public health events of international concern to WHO. WHO also provides emergency medical teams and logistics support. WHO cannot achieve its goals alone. It actively partners with United Nations agencies, national governments, NGOs, the private sector, the academic institutions. For example, WHO works with UNICEF on child health and immunization, and with the Global Fund on HIV/AIDS, tuberculosis, and malaria programs. Such partnerships ensure that expertise, funding, and action are coordinated and maximized globally. In the Philippines, WHO provides technical support and guidance to the DOH and local government units, strengthening implementation of the Universal Healthcare Law, improving maternal and child health services, supporting surveillance and response for communicable diseases like measles and tuberculosis, helping design interventions for NCDs and emerging challenges such as mental health and climate related health risks. WHO's influence is evident in many of the national health programs and priorities we follow in the Philippines today. Let us now look at the Millennium Development Goals, or MDGs. MDGs were one of the most important global frameworks that shaped health and development efforts from 2000 to 2015. The MDGs were adopted by the 189 United Nations member states. This included the Philippines, and this happened during the Millennium Summit in the year 2000. They represented a global consensus, an agreement among both developed and developing countries to work in partnership to combat poverty, hunger, disease, illiteracy, environmental degradation, and discrimination against women. The MDGs aim to provide a clear set of targets for governments and development partners to guide programming and resource allocation for 15 years with a target end date of 2015. The MDGs were based on shared human values, making them not only technical targets but also moral commitments. Among the key values were freedom, ensuring that all people have the right to live free from want and fear. Equality, guaranteeing equal opportunities, particularly for women and the marginalized groups. Solidarity, fostering global cooperation, especially between the rich and poor nations. Tolerance, promoting respect and understanding across cultures. MDGs also had health related targets. They emphasized respect for nature or environmental sustainability. MDGs fostered shared responsibility, recognizing that all nations, rich and poor, share accountability for global development. In the Philippines, these values were embedded in national strategies such as the Philippine Medium Term Development Plans and the National Objectives for Health. The eight MDGs were broad yet practical and focused on addressing the most urgent development challenges. These were the eight goals: to eradicate extreme poverty and hunger, achieve universal primary education, promote gender equality and empower women, reduce child mortality. Improve maternal health, combat HIV/AIDS, malaria, and other diseases, ensure environmental sustainability, and develop a global partnership for development. These goals achieved substantial progress globally and in the Philippines. Extreme poverty was significantly reduced. Child mortality was dramatically improved. And this was because of the expanded immunization and better nutrition. Access to primary education likewise improved, not only in the country but also globally, and with emphasis on greater gender parity. However, some gaps remained. Many countries, including the Philippines, struggled to fully achieve maternal mortality reduction targets. Progress in universal primary education was uneven, especially among indigenous people groups and remote populations. HIV/AIDS and tuberculosis remained significant challenges. These lessons were crucial in shaping the more comprehensive and inclusive sustainable development goals that replaced the MDGs. In the Philippines, the government adopted the MDGs through alignment with national policies. The development of the Philippine Development Plan, the National Objectives for Health, which was used from 2005 to 2010, and from 2011 to 2016. There were also targeted programs to address health among children and mothers to reduce maternal mortality, and also programs to combat HIV/AIDS, malaria, and tuberculosis. Examples include the expansion of the EPI, or the Expanded Program on Immunization, and scaling up of the maternal health services through birthing homes and skilled birth attendant training. Though not all targets were fully met, the Philippines made strong gains in reducing child mortality and increasing access to safe water. As nurses and health professionals, we must understand this history because many of our current programs still build on the momentum of the MDGs. Following the MDGs, the world realized that the next development framework needed to be more inclusive, comprehensive, and sustainable. In 2015, the United Nations adopted the Sustainable Development Goals, or SDGs, a set of 17 goals and 169 targets to guide global development from 2015 to 2030. The SDGs go beyond poverty eradication and health. They encompass economic growth, social justice, environmental sustainability, and peace partnerships. Critically, health remains a core component through SDG 3, which is to ensure healthy lives and to promote well being for all at all ages. The SDGs are guided by three core principles: universality. This means that the SDGs apply to all countries, not just developing nations. Integration. They recognize that progress in one area, such as education, influences other areas, such as health or gender equality. One key principle is to leave no one behind. They aim to address inequities, ensuring that no individual or group is excluded from development benefits. As nurses working in communities, these principles remind us to design inclusive health interventions, address social determinants of health, and prioritize vulnerable and marginalized populations. The first five SDGs address foundational human needs and rights. SDG 1 aims for no poverty. This is essential for health, as poverty is a primary determinant of poor health outcomes. SDG 2, Zero Hunger. Undernutrition is linked to child mortality and poor cognitive development. SDG 3, which is to promote good health and well being, is our core area of contribution as nurses. SDG 4 is aimed to provide or achieve quality education. This promotes empowerment and informed health behaviors. SDG 5 is focused on gender equality. This ensures that women and girls can access the same health and social opportunities as men. For example, programs promoting exclusive breastfeeding in the Philippines contribute to both zero hunger and good health goals. Goals 6 to 10 focus on the broader systems and conditions that impact health and well being. SDG 6 is focused on clean water and sanitation. This prevents waterborne diseases and support dignity and health. SDG 7 is for affordable and clean energy, helping reduce respiratory illnesses linked to unsafe fuels. SDG 8 is on decent work and economic growth. Employment impacts income, food security, and access to health care. SDG 10 or SDG 9 is on industry, innovation, and infrastructure. This drives economic development and health system improvements. SDG 10 is aimed at reducing inequalities. This is to promote fairness in health service access and resource distribution. As nurses, we must advocate for these broader determinants because they shape the health of individuals and communities. The remaining SDGs emphasize the environmental, governance, and partnership dimensions of sustainable development. SDG 11 is on sustainable cities and communities, promoting safe and healthy living environment. SDG 12 is on responsible consumption and production, encouraging sustainable resource use to protect future generation. SDG 13 is on climate action. Climate change affects health through increased disasters, vector-borne diseases, and malnutrition. And then we have the other SDGs for life below water and life on land. We also have SDG on peace, justice, and strong institution, and SDG 17, partnerships for the goals. SDG 3 is the health specific SDG, focusing on ensuring healthy lives and promoting well being for all at all ages. SDG 3 or SDG on health has the following targets: reduce maternal mortality to less than 70 per 100,000 live births, and epidemics of AIDS, TB, malaria, and neglected tropical diseases. Achieve universal health coverage, an area of active reform in the Philippines through the Universal Healthcare Law. Increase access to essential medicines and vaccines. As community or public health nurses, our daily work directly contributes to these targets through immunization campaigns, maternal care, health education, and chronic disease prevention. Health equity is at the heart of the SDGs. Addressing the social determinants of health like education, employment, and housing is central to achieving equitable health outcomes. The universal health coverage aims to ensure that all people, regardless of income or geographic location, receive the care they need. The SDGs stress gender sensitive and age sensitive interventions to address specific needs of women, children, elderly, and persons with disabilities. As nurses, we play a vital role in identifying disparities and advocating for policies and programs that close the gap. The Philippines has integrated the SDGs into national plans. The Philippine Development Plan aligns with the SDGs. The national objectives for health reflect targets under SDG 3 and other relevant goals. DOH prioritize improving access to primary care, strengthening the health system, and enhancing resilience to climate related health risks. Programs such as Kalusugan Pangkalahatan, expanded PhilHealth coverage, and integrated non communicable disease prevention are examples of how the country operationalizes the SDGs. Despite strong commitment, challenges remain in achieving the SDGs. There are financial gaps, especially for universal health coverage and social services. Governance, which is ensuring transparency and also in accountability in health programs. data collection and monitoring. There is still a lot of work to do to improve health information systems to make it more efficient with regards to tracking progress. Cross sector collaboration. Health must engage with education, housing, environment, and other sectors to achieve broad outcomes. Nurses must be active leaders and advocates in overcoming these challenges at both the local and national levels. Now, what is the role of community or public health nurses in advancing the SDGs? We need to advocate for policies and programs that promote health equity and social justice. We implement community based health promotion interventions that address multiple SDGs. We foster multi sectoral partnerships to address complex health challenges. We monitor and evaluate health progress within communities, contributing valuable data to inform action. In short, we are not only caregivers, we are educators, advocates, researchers, and leaders in achieving sustainable health for all. In summary, we discussed the following. WHO leads global health efforts and promotes equity and universal coverage. MDGs reduced poverty and improved health outcomes and indicators. The SDGs broaden the global agenda for sustainable development and health. Public health nurses drive SDG progress through community action and partnership.